Morning, Shanna here from Certified RN. I just wanted to talk briefly about the second injection that I had received, because there's a lot of talk over whether or not people were having like worse side effects with the second injection or not. For myself, this is just all from just what I experienced with the nurses that I worked with. A lot of them who've had some sort of symptoms or side effects from the first one, they tend to get it from the second one. But what I did find is that the ones that were feeling like feverish and had malaise and overall just kind of like really mild flu-like symptoms, when they went to get the second injection, if they kind of like prophylactically took like Tylenol and ibuprofen together. Now, I'm not saying for you to do this. Of course, you have to talk to your own provider, but like this weird synergic effect between the two actually lessened their symptoms quite a bit. So I took Advil according to the bottle and Tylenol, and yes, I did take them at the same time, but oh my gosh, I barely noticed anything. And the first time I was fatigued, I took a 2-hour nap and I couldn't lift my arm up more than this. So I'm not telling you what to take, but maybe you could talk to your healthcare provider if that would be helpful for you. But anyways, I'm very excited to be vaccinated now. Another question I got was, why did we end up getting the Pfizer BioNTech over Moderna? And honestly, it's basically just because the Pfizer one came out a week earlier. So, and because I'm an ICU nurse, that puts us in that tier 1 of getting our injections first. Anyway, so one big thing I noticed is that, you know, whether or not you get the Pfizer or Moderna, there's like maybe a difference. I think like for the one that I got for Pfizer, it was a 21-day wait in between the injections, and I believe that Moderna is a little bit longer than that. But both are mRNA technology, where basically like this little genetic code produces, sends it to our cell to produce this little protein, and this protein activates our immune system to be able to defend off the COVID-19 virus. One thing though is that both of these vaccines need to be stored in extremely cold temperatures. So Pfizer needed to be a negative 75 degrees Celsius, and Moderna is a little more flexible with that negative 20 degrees Celsius. So, and then now there's talk of the Johnson & Johnson one coming out, which would be a single dose. So anyways, just wanted to share my experience with that second injection, and so happy to do my part to try to end this virus. And honestly, I'm tired of seeing all these sick people and people pass away in the hospital. It's killing me, and I know I say this for myself and many of the nurses that I work with. Please do your part and let's all get vaccinated so we can stop this. All right? Thanks so much. Bye.